Hello everyone, I'm Dr. Sharvari Pandit. I'm practicing at Pandit Clinic in Pune. I'm a dermatologist. I'm talking to you today on the behalf of DermaVidya. It gives us all the access to dermatology world. Today we will be discussing about acne and some tips to manage it well. Acne is one of the commonest skin conditions all around the world. It is generally more common in the ages of 19 to 35. But nowadays with the changing lifestyles, we see acne extending well into the late 40s. Nowadays, acne affects people of all the ages. It affects both genders equally. Sometimes you see acne earlier in young girls because of the early onset of puberty. Acne in young people and even in adults sometimes is associated with low self-esteem, a mild level of depression, and also sometimes dissociating from the social circles. Acne is associated with low self-confidence. It is also associated with a mild depression. Acne causes some level of social withdrawal. The emotional and the psychological impact of acne is quite huge, and we really need to teach our patients to deal with this social impact a lot more with passion and care. So what is acne? Basically, acne is a disease of pilosebaceous unit. Now, this pilosebaceous unit consists of a hair, a sebaceous gland that is next to it. So this is the model of skin. Here you can see the hair, you can see the hair follicle, and you can see the sebaceous gland. This is the oil producing gland. So this basically entire structure is called a pilosebaceous unit. This gland secretes oil or sebum. This oil is secreted into the hair opening. Through this hair opening, this oil is released onto the skin. Now many a times this gland secretes excessive oil that blocks this opening here pore. Also sometimes there is improper clogging because of some problem here up on the skin, because of which the entire secretion just gets collected in the opening here and the gland gets infected and it bursts inside the skin. The improper blocking of this pore forms closed comedones or open comedones called as whiteheads or blackheads. There are certain hormonal problems like PCOD or androgen or the main hormone excess that can cause sensitivity of these glands. Sometimes it also causes excess secretion of these sebaceous glands. The whiteheads or blackheads eventually progress to become pustules. So pustule is something that contains a pus. Sometimes they even get bigger. They become very big. You can actually feel them on your skin. So these are called as nodules. These are very higher stages of acne. If the acne is not treated on time, if you don't take the proper treatment, there is a possibility of pigmentation. There is also a possibility of scarring. It is very difficult to remove the acne scars once they are formed. There are multiple aggravating factors that affect acne. Sometimes a humid weather, sometimes a wrong makeup product. Sometimes there are dietary changes that you have a lot of excess sugar in your diet, something like ice creams, cakes or chocolates or sweets. They can cause sugar spikes in your blood and they are known to aggravate acne. Certain wrongly done treatments like a wrong facial or a wrong scrub or causing excessive trauma to your skin, rubbing your face too often, doing a cleanup can also cause a lot of acne. If it is wrongly done, these treatments are troublesome for your skin. Using excessive oil on your hair or sometimes on the face also can cause acne. Certain medications like steroid containing creams or sometimes steroid tablets also can cause acne. So all the patients with acne should remember this, that they should never pick up any random products from the skincare departments or any medical store, or for that matter even online. They can cause a lot of problems aggravated for themselves. For all the acne patients, hyaluronic acid and ceramide based moisturizer provide a very good hydration. For all the acne patients, a good hydration is important. Ceramide based and hyaluronic acid based products are very helpful. Active exfoliating products like salicylic acid should be used with caution. They can cause a lot of drying of your skin, so they should be used under medical guidance. Tretinoin creams also must be used under medical guidance. It is always better to get a tailor made program for your skincare when you have acne. Your dermatologist can always help you with that. Sometimes your acne grades could be a lot higher where you may need oral medication. Only topical applications might not be necessary. Using good oral medication and good topical care together under your dermatologist's guidance can help you treat your acne better, faster, and it can also prevent complications like scarring and pigmentation. Removing blackheads at home is not a very good idea always. If it is not removed properly, it gets infected and your acne worsens. A good 7 to 8 hours of sleep between 10 pm and 6 am is mandatory. A moderate exercise will improve your skin's blood circulation and it will give you a better, faster clearance of acne. Stress might make you start picking at your acne. So when you're sitting alone and you keep doing this, you are going to get scarring. Whenever you have acne bout and if you're really stressed about it, it is better to go and see your doctor. Do not look at yourself in the mirror all the time. It will stress you out more. So whenever you're choosing your makeup products, make it a point they're all oil-free products. So the first should be your primer. The primer should be used generally just like a light moisturizer, so that can contain a ceramide, a hyaluronic acid. So no other primer is needed, just a moisturizer is sufficient. You can use a light sunscreen over it, preferably a gel based or a silicone sunscreen can be used, and then use a light makeup. Do not go layering. Avoid blush. Remove your makeup as early as you can. Wash your face clean before you sleep. The best home care that you can do for acne is following a great lifestyle, good sleep, good food, and a stress-free life. Consume less sugars and avoid alcohols. I hope I have been providing you with some insights and they're going to be useful to you. If you like this video and if you want to watch some more, visit www.dermavidya.com, and for all your skin and hair related issues, visit your nearby dermatologist. Thank you for watching.
For more such videos, visit or log into dermavidya.com.